We are really looking forward to a dynamic dialogue on how the use, but also the misuse of digital technology is shaping young people's health and well-being, healthcare delivery, and health systems more broadly. In parallel, we really hope to discuss the implications of growing digital divides as concerns about privacy, accountabilities, and inequities are increasingly clear. Overall, as on behalf of the whole initiative, we really hope that you will enjoy the webinar. Now I am really delighted to introduce our co-host, Michaela Newman, who is a Policy and Research Officer at the Lancet and Financial Times Commission on Governing Health Futures 2030, Growing Up in a Digital World. And I will now let her say a few words. Thank you.
Thank you, Mia and Arinze. So the Lancet and Financial Times Commission was launched in 2019. And it brings together 17 global experts as commissioners, as well as Ilona Kickbush and Anurag Agrawal as co-chairs. And together they're exploring the political and social intersections between technology, health, and future generations. So that's kind of the purpose that has brought some of this discussion here today. Governing health futures. These three words say it all. What new frontiers of governance must we explore to uplift health and universal health coverage so that future generations can flourish mentally, physically, and virtually? Who drives this data and digital world, and who risks being left behind? What are the promises and pitfalls of digital technologies for health? What multilateral partnerships do we need for digital cooperation for health? And how do we rebalance the table of those involved? I mentioned that the Commission is comprised of a number of global experts, as well as a small secretariat who supports them. But this work cannot be done without young people. Young people will inherit the decisions and governance pathways determined today, and youth are already leading much of the digital transformation. COVID-19 has highlighted the ways in which technology connects and divides us, and more broadly indicates to us the uncertain futures young people face. On the occasion of the 75th anniversary of the United Nations, it is not just a matter of growing up in a digital world, but in demanding the health futures that youth want and need online and offline. So on behalf of the Commission and Secretariat, we are so excited to hear today's discussion across this entirely youth panel, and a big thanks to the leadership of the Global Health Young Professionals Initiative for spearheading this incredible UN 75 dialogue. Thank you also to each of the speakers, and I'll hand it back over for their introductions. Thanks.
Thanks, Michaela.
And now I have the pleasure to introduce our amazing speakers. We are really excited that our speakers have given us this privilege to listen to their wonderful ideas and their thoughts around this topic. They have come from different parts of the world, from diverse backgrounds, because we recognize that global health in its sense is not a job of doctors, nurses, or pharmacists, but every stakeholder, every sector, every discipline has a role to play in furtherance of global health. And just to do a quick rundown of our speakers, as some of us have already seen in the brief that we must have shared to you, we have Dr. Shakira Chunara, I hope I'm saying your names correctly, forgive me if that's not the case, who is a public health researcher from Johannesburg, and she'll be taking us through the concept of digitalization in global health as it affects health systems in all parts of the world. And then that will be followed by Joanna, who is based off of California and works with Google. And she will take us through digitalization and what trends there are, what is the global trends and applications, and what perhaps the big tech guys are cooking up, and that could have an impact in global health. And then that will be followed by Luca Schwartz, who is a global health manager at IFPMA, that's the International Federation of Pharmaceutical Manufacturers and Association. He will take us through some of the digital health innovations, especially from the innovation sector. And then that will be followed by Yassine, who is a representative from the Young Experts Tech for Health, based here in Geneva. She will take us through digital health governance and all of the issues that are cross-cutting between countries and between sectors, between different technology interventions. And then lastly, we have Akash, who is the representative from WHO Afro. He's also involved with the Transform Health Organization and the Global Health Center. He will then take us through the concept or the idea of the future that we are not just looking forward to, but that we are already experiencing, and what we young people want in the idea of digitalization. So without further ado, I would like to welcome Shakira Chunara. And if I'm allowed to, if you don't mind, Shakira is a public health researcher and is an independent public health researcher, and was the 2017 Woman of the Year in Health in South Africa. She's also the Destiny magazine's most powerful woman under 40. I think that's a pretty big deal. Her most notable and influential role to date is that she's been appointed to the inaugural African Union Youth Advisory Council. She's also widely known and published for her work in public health on the front of universal health coverage. In addition to that, she is an ardent youth advocacy activist, and she is involved in health governance, gender equality, HIV, disability, and malaria prevention. Shakira, over to you.
So I guess it's good evening on my side, and I don't know what time it is for everyone else, but I must say, Arinzi, thank you for that. And you forgot to mention that we had a completely virtual mentor-mentee relationship until you picked me up at the airport in Geneva. So I think that's the generation that's joining us this evening. We have completely virtual lives. And of course, we like to meet in person. This time around, I think one positive is that we don't have 14 hours, or I don't have 14 hours of jet lag before we check into the United Nations. So on that note, I'm no tech expert at all, but I think our generation, specifically the millennials and Generation Y and everything that comes after that, we live on social media, we breathe digital. And so for many of us, we've been working virtually even before the pandemic. And so I'm coming in from, very brief sort of topical issues that I want to spark in everybody's mind, and I hope you'll interact with the chat. And the first thing that comes to mind is we don't need to tell young people that there are opportunities for digital health. We know that, we live that. I think essentially though, what I'm finding in this space is while we're talking a lot about digital, going with technology, when we're speaking about universal health coverage, as the younger generation, we're not pushing our governments enough, we're not pushing decision makers enough to say, how do we reimagine our health systems? Because we still think of a health system as a patient going into a facility, getting care, and then leaving. I was actually speaking to a colleague who's running self-testing in South Africa on HIV. And, he says what COVID's showing us is that going the route of either self-testing or having healthcare at your fingertips is basically the way to go. But unfortunately, we don't see this in practice, not at least on the African continent. One of my favorite reports is by Plan International and a few others, and he talks about adolescents. And there's a young adolescent from Asia who says that I want healthcare to be a simple click away. And so I think our challenge as younger professionals in this field is in our spaces, how do we push to have healthcare just a simple click away? So I think that's really our challenge for universal health coverage. Again, I'd say that we need to reimagine the way we do things. A few quick other points, and I come in speaking from an advocacy perspective, but I think that many of you engage in this anyway, is the digital advocacy space it's booming, and it's been booming before COVID-19 as well, in the way we create gender-based violence campaigns, in the way we create hashtags, the Me Too campaign. So we're seeing a lot of it in the gender space, and I think that's quite incredible. Mm-hmm. I think that with our hashtags, what we're finding is that we have the power of hashtags. And in South Africa, the student movement managed to bring down university fees just using a hashtag which spread across all universities. And that's what made the protest a few years ago different to previous years, was the use of social media. We see that with the Me Too campaign as well. So I think another challenge for us as young people is we have the space to influence, but how do we really get our topics and topics that are important to trend? That's a big one. The third one I talk about personally is participation. And I must be honest, in the earlier part of my career, I'm actually, no one will believe this, I'm actually a very shy, reserved person. And I can see Arinzi definitely not believing this. But essentially, I think as younger people, we feel a bit intimidated when we get into conference settings, or especially when you're new to the field. And for me, I found that the social media space allows you to express yourself and do so in an authentic way, if that's the way you want to go. But the other powerful element is the networking, the collaboration, and finally, the linkage to decision makers. And I'm pretty sure, I don't know if Dr. Tedros now has a team running his account, which I probably suspect, but in the times before he was appointed to the WHO, I actually direct messaged him and I was able to get into contact with him. And he's just one of many other policy makers that I've been able to reach through social media. So I think that it's about how do we have a proactive approach in advocacy, how do we target decision makers? It also gives us a lot more insights into transparency. And then I'll finally wrap up by saying, and it goes back to my point on universal health coverage, but also on what our national governments are doing, what our continental governments or bodies are doing, like the African Union, like the European Union. But what I'm finding in the national governments, and South Africa just released its digital strategy. And in the entire digital strategy document, not once is young people or are young people mentioned. And for me, that's a problem. So I feel like there's a lot of talk about this digital space. We as young people know the opportunities, but is it really coming together to deliver healthcare? I think the opportunities are there. It's just how do we leverage it, how do we build on it, and how do we push our governments essentially. And I'm going to end up for now, before I have another music insertion, I suppose.
Thank you so much, Shakira. So as we said from the beginning of the session, compile your questions. You can also put them on the chat box. We're collecting them. And at the end of this speaking session, we're going to have a discussion around those questions now. And we'll give you the opportunity if you'd also like to make a contribution to speak in person, or we just ask the questions directly. So the next on our list is Joanna. I'm careful not to say your surname because I'm pretty sure I will not pronounce it correctly. Joanna is
Nobody does.
She's a trained pharmacist and a business leader committed to solving impactful problems at scale. Currently at Google, she leads international and cross-functional teams in the areas of machine learning and artificial intelligence. Prior to Google, she worked on innovation consulting, developing solutions in digital transformation to multiple Forbes top 500 companies. Before moving to the United States, Joanna served as the FIP coordinator for the International Pharmaceutical Federation in The Hague, the Netherlands, where she worked closely with the WHO, UNESCO, and the United Nations. She holds an MBA from IE Business School and a master's in pharmaceutical sciences. Joanna?
Thank you so much, Arinzi and Mia, first of all, for the invitation to be with you today in this session. If there's one key takeaway that I would love you to get after my short intervention, is that we need to bring joy back to medicine, and technology is here to help. So nowadays, there are many barriers to what we normally say in tech, a joyful healthcare experience, both for healthcare professionals and patients, mainly because medical records and access to patient data are still not fully integrated. healthcare systems, they still operate with slow servers and primarily with old tools. They are not standard across the world. And there's an information overload that we were talking about before, which makes it even more challenging to really understand what's happening in the world from the perspective of the masses, but also when it comes to understanding diseases and having an understanding and an agreement within the scientific community. So all this together brings many challenges to the healthcare systems and public health, especially as patients and younger generations who are more tech savvy and have more access to information. This can be good, but at the same time, this information is not always accurate, or the reader doesn't have the capability to really digest this information in the correct way. And this is especially alarming if we consider that before the pandemic, 1 in 20 Google searches were health related. So can you imagine how it is right now? And with the pandemic, we don't know what's true. We don't know what are real or fake news. So it's really important to work with companies, especially those that have or host search platforms, in order to make sure that the most trusted or the most scientifically accepted results, they are featured on top of these searches, because those are the links that people click to. So it's really important that we have these dialogues in which we bring healthcare professionals, tech professionals, governments, academia all together in order to really understand what should be the future and how can we shape the future together and make stronger healthcare systems. I'm a firm believer that technology always progresses faster, especially during crisis. So I really hope that one of the biggest outcomes of the pandemic will be the digitalization of healthcare systems. Telemedicine will increasingly become a common practice, and apps and other devices such Alexa, Google Home, or even the HomePod by Apple will become tools that will be used as monitoring tools for patients, but also they will support diagnosis and continuous care at home. There are a few studies already going on using these tools, which I find very interesting on how we can leverage technology and these tools not only to support diagnosis, but also the continuous monitoring of healthcare patients at home. Wearables such as the Apple Watch and others, they will provide 24/7 information, which can even potentially minimize the need to perform certain medical tests. So I don't know if you've seen, just this week, Apple launched the new Apple Watch, which has an O2 blood sensor, which is a similar technology to what Fitbit and Garmin already had, more advanced in a different way. But anyhow, these tools are all designed for wellness right now, not for medicine. However, if there's a player or a payer that decides that these tools can be moved from wellness to medicine, and they can be used as preventive tools, if health insurance companies pay for these tools, then these devices will become common practice and will be in the hands of millions of patients all around the world. So another good example of these wearables and how technology is changing medicine is the Whoop strap, which is another wearable that is pioneering the detection of COVID by analyzing the respiratory rate and other heart factors. And all these devices are being built by leveraging machine learning technologies. And this opens doors for many innovations across the board for new sensors and other technologies having a key role in medicine. So now the important question, and it's something that I always like to challenge, especially the younger generations, is how do we train the next generation of healthcare professionals? How do we ensure that they know how to leverage technology and use it best to support their practice? Is their education enough, or is it tailored to the needs of the professionals of the future? I'm not sure. That's why organizations such as the Global Health Young Professionals Initiative, and thank you so much for organizing this conversation, are really important to really bring awareness to the needs of the younger generations of healthcare professionals and to the future education, which is something that really concerns me, because with patients having so much information at the end, at their fingertips, so how are they going to really educate these patients that already have access to so much information? Do they really know how to use that information to best suit their health needs? What does the patient journey of these patients will look like in the future? So that's why I believe that we have to work very closely with tech companies, governments, pharmaceutical companies, medical professionals, organizations, younger generations, and voices that have new ideas and bring new needs to the table to really tailor healthcare systems, the way they are organized, and educational systems to really close the gap in our education. All these technologies, they can bring back joy to medicine as well. But for that, we have to empower healthcare professionals so they can really spend more time with patients and doing what they know how to do best, instead of having to deal with the burning of admin tasks all the time. A recent study that was just released before the pandemic in March, it showed that amongst 3,000 healthcare professionals that were across from 15 countries, it showed that doctors are really overwhelmed with patient data, especially young doctors, because they were not trained to use these systems to support diagnosis and continuous care. So we really need to create new training to leverage data analytics and technology to inform their care. And we say that these smart technologies, by the way, there's a slight difference between artificial intelligence and machine learning when we talk about all these tools. Artificial intelligence is the science of making things smart. Machine learning is a technique that is used to develop AI, and there's so many others like speech recognition, neural networks, etc. So when we say smart, we don't necessarily say that these technologies are intelligent or conscious in a way that the person is. Instead, we simply mean that these technologies are good in solving a particular problem or a class of problems. So that's why I was mentioning before that we need to put these technologies in practice to support medicine and not the other way around. So machines will hardly replace healthcare professionals, as sometimes we come in here. We hear it very, very often, especially as one of the concerns that younger generations have, but they will instead complement their practice and make it more efficient. All these technologies, they have a human-centered approach, which means that they are designed by putting the patient and its needs at the center of the healthcare system. And then all the solutions that are created and developed, they are pursued in a way that we really find the solutions for the right problems that people really have. There are a few more examples on how we can leverage these technologies, especially when it comes to diagnosis, and the advancements in technology, they are on par, if not sometimes even better than doctors when it comes to diagnosis, because through predictive analytics, these technologies, they can survey millions and millions of patients and data based on their medical records. So they can tell with a very high precision which patients will have more chances or will be more likely to be readmitted in a hospital setting, which is really good if the doctor knows how to use this information, because instead of looking at all the patients that they have, they can really focus on the ones that may need more attention or more care. So it allows doctors and other healthcare professionals to really act beforehand and have a higher impact on the patient's health and well-being. So we can decrease mortality rates and improve patient safety overall. In terms of treatments, these technologies also can provide guidance through imaging, again, scanning through millions of cancer images, of medical images, x-rays, and really support with decision-making trees for healthcare professionals. In terms of research and development, we've seen now that with the COVID vaccines that have been developed, they're leveraging machine learning, but also the openness that we see in the pharmaceutical industry. I think it's something great that is, again, arising from the pandemic. And just lastly, I don't want to take much long, otherwise I'll also hear the music and the trolls coming. But I just wanted to say that cloud infrastructure is, imagine a world in which all the systems and services are integrated and all healthcare professionals have access to patient records to really provide really good care, from primary to secondary to pharmacies to post-discharged care. So these systems, they are safe, they are reliable, and they can even increase the performance of healthcare systems by 50%. There's so many studies already around that, and they can bring so many savings and thousands of millions of dollars that are spent every year on inefficiencies. So just going back to my key takeaway, let's bring back joy to medicine, and technology is here to help.
Thank you, Joanna. I love this idea of bringing joy back to medicine, and hopefully we can discuss this further in the discussion later.
Sure.
And how much it can bring joy into our lives. Now I am happy to present Luca, who's joining us from IFPMA. So I believe Luca started there in March 2018 as an intern and is now currently a manager in global health policy. So his work is centered on various global health policy topics, including the cross-functional area of digital health, working with IFPMA members and collaborating with external stakeholders in striving to deliver sustainable benefits to patients and health systems through digital health solutions. So quite a large panel there. At IFPMA, Luca is also part of a youth team, which aims to foster dialogue with young people interested in global health topics, highlight and support the work of pioneering young entrepreneurs in the healthcare sector, and mobilize, empower, and connect young representatives of innovative healthcare sectors. So Luca, welcome, and we're so happy to have you here.
Yeah, thank you very much for the introduction, and thank you also for the invitation. I'm really excited to be here today with all of you and the panelists and the participants. You know, I would just say first that being part of the IFPMA youth team, as you mentioned, also having a healthcare background, I'm a pharmacist by education. I was also part of the International Pharmaceutical Students Federation in my student days. And even at the time, I always believed that youth have a really strong role to play in many of the issues that the world is facing. And I think especially true, that is especially true when we talk about the digital health revolution. So I'm really really excited to what the discussions will be on that as we move on as well. Maybe, you know, I think in these times of accelerating scientific innovations and new technological solutions, if I move on with with my presentation topic, it is certainly a very interesting time to be part of the biopharmaceutical industry, which I think we can definitely call a driver of change in this digital health era. We have the unfortunate COVID pandemic, which has, on the other hand, also forced all stakeholders to think and act differently, and has really been, I think, a game changer in proving the real world value of many digital health solutions that have emerged. And I think we can all agree that digital health does help us build more effective, efficient, patient-centric health systems, which is really crucial, especially in times like these when we're trying to combat this double burden of infectious disease on one hand, but also non-communicable diseases that are still very much present. And in relation to the biopharmaceutical industry, digital health technologies really do impact every aspect of the value chain. We're talking from drug discovery to clinical development through product launch, post-market stage, and of course, support for patients and healthcare professionals as well. And we are seeing, I would say, across the industry, heavy investing to transform the contributions the industry makes to patients and health systems. And this is really happening in a variety of ways. Maybe a good thing to mention first is the improving of drug and vaccine research and development, as well as clinical research. We're seeing, for example, companies accelerating smart drug and vaccine development by leveraging artificial intelligence, advanced data analytics, which can be very helpful in trying to discover new disease targets, targets for medicines, and of course, analyzing huge volumes of data, optimizing analytical processes, and also improving clinical trial processes. So this is probably one of the most important components as far as it relates to the actual research. And there's a lot of interesting projects that we can see on this, also collaborative. You have some, for example, taking shape of a federated approach in which you have a large amount of companies collaborating towards one let's say, main objective. But also, I think equally important is the fact that if we look at the supply chain processes, for example, digital health tools, or rather just digital tools, can really help us optimize these. And these are being used and explored to optimize the steps required to ensure that the right medicine reaches the right patient at the right place and the right time. And this is really something that's mission critical, particularly if we look at the context of COVID and contemplating future approval of and deployment of vaccines and treatments. It's going to be very important that that things hold through on the supply chains. And also, you know, in terms of what the biopharmaceutical industry is bringing in terms of digital health innovation, we also mustn't forget the stepping up of communication, training, and education, where we see companies supporting the increased use of digital and e-learning platforms to raise awareness, communicate on critical health issues, and also to provide training and education to patients and healthcare professionals. And sort of linked with that, it's also, you know, about increasing patient engagement and support to improve ultimately their health outcomes by using digital solutions, which can range from very simple to more complicated. And again, I would mention here perhaps machine learning and analytics to provide quality information back to patients and also improve the understanding of patient needs, see if there's any insights on adherence to treatment, and also, again, ultimately, at the end of the day, positive health outcomes. But as mentioned in the beginning, when we're talking about, for example, this double burden, which is, you know, very much the case in the case of a pandemic, you have, or rather, I would say it's very important to alleviate health system capacity constraints in any way possible. And you also have companies supporting increased use of remote consultation, monitoring, and care provision to better reach patients who are unable to seek in-hospital care. And also this helps providers address the capacity constraints which may be emerging. And last but not least, certainly an important component in this is leveraging in-house expertise, global reach, and new collaborations. You have companies launching dedicated laboratories, innovation hubs, and multi-stakeholder partnerships to accelerate digital health development, deployment, and uptake. And here, really, you know, I'm thinking about digital health in a rather broad manner. So yeah, definitely, you know, I think there's a lot that's been happening over the last years in terms of digital health in the biopharmaceutical industry. I think somebody earlier, one of the speakers, mentioned that the policy space on digital health is, of course, very much booming. And this is really, I would say, at least in my view, something that's picked up tremendously over the last years. And on our side, we are very keen to work with other stakeholders to deliver sustainable benefits to patients and health systems through digital health solutions. One key example, perhaps, that I could put forward is, and this links back to my involvement in the youth team on our side, as you mentioned, is that the youth team is planning to launch an award for young innovators in Africa with solutions that would have a positive impact on health and, in particular, healthcare workers. This is something that, you know, might include digital health innovations as well. So we are really trying to, you know, do our part as well. And young people, I think, well understand the transformative power of digital technologies and should definitely play a major role in motivating all of the health system stakeholders to embrace digital and data transformation as a very strong opportunity, rather than as a set of overwhelming challenges that are too difficult to address. And certainly, I think we can all recognize that that there are challenges in the development, deployment, and uptake of digital health-related solutions. But I think with broad stakeholder collaboration, we can definitely move forward and leverage the digital health solutions that are and that will be available. And maybe just to take a couple of the minutes that I think I still have left. One of the subpoints in my topic is also to mention a couple of challenges, and I think we can think about various sort of groups of challenges as far as it relates to digital health solutions. On one hand, you have structural challenges, which include the lack of investment in infrastructure, lack of connectivity and internet access even, and very importantly, also limited interoperability between different systems and databases, which, maybe at a first glance, you would understand that as to be happening between countries, across borders, but these challenges can even exist within a country and even between different hospitals or otherwise. So that's why I think, together with that, it's really important that we have this international collaboration going on, that we have cross-border collaboration, and that's certainly one of the ways that we can, address at least some of these structural challenges that affect digital health as such. And very briefly, maybe also on the so-called human challenges, right? I mean, ensuring that the health workforce and patients are open to change, trained to use digital tools. Here, education is really key to enhance overall literacy, especially among the populations that are maybe harder to reach. And digital health solutions need to be seen as a way for patients to enable them to manage their own health, make informed decisions, and again, all keeping in mind the ultimate goal to achieving better health outcomes. And here, the youth have a very important role to play. I mean, they call us digital natives, and it's we've grown up in the digital era, so we understand the technologies that are emerging. We understand the technologies that are out there, which essentially makes the youth a very powerful possible advocate for embracing these technologies. Certainly, there's also equity challenges that can arise from the digital divide. You can have swaths of unrepresentative data that can contribute to increasing the gap between those who have access and benefit from technologies and those who don't, which is, I think, also important to note. And last but not least, fourthly, we could speak about policy challenges that arise from a lack of harmonized governance for digital world. A lot has been happening again over the past years in the digital world. So we need to find a way to reconcile this sort of progress with harmonized governance to support this progress. You may have unclear or ill-suited regulatory pathways, funding mechanisms, and other policies that may be showing their outdatedness as far as it relates to the rapidly progressing digital technologies. And digital technologies, by definition, do progress very rapidly, right? I mean, if you have something that's built off of machine learning principles, the tech itself is going to change, and that also is a very important component here. And I think we really need to speak about fit for purpose governance systems, data governance systems that on one hand ensure patient privacy and data security, but also enabling the relying and leveraging of patient records and other health data, again, with the ultimate goal to improve patient health outcomes and health systems quality and efficiency. I think this is really critical, and again, this is something that I think can only be achieved by broad stakeholder collaboration at all levels, and really working on better defining this and addressing the challenges that still pervade digital health technologies. So I think we in addition to the fact that we need to work together to address these challenges and barriers to approval, use, and uptake of digital health solutions, we're also, very much ready on our side, willing and able to contribute to this work. And again, I cannot stress enough the importance of working with young people, who are, at the end of the day, tomorrow's health system leaders, healthcare professionals, caregivers, and working in a broad variety of sectors in the world. I really think that this youth component is a very important one, and the youth can definitely do a lot to drive this progress forward. Thank you.
Yeah, thanks so much, Luca, for your insights and for highlighting also some of the challenges, especially regarding the digital divides. And it's interesting to see that it's not only, as you're saying, not only between countries, but also amongst countries, and the importance of digital literacy amongst other themes are really important. So thank you so much. I would just like to remind everyone that you are more than welcome to post any questions in the chat box, if you may say so, or any comments. It would be great, so then we can have an interesting debate afterwards. But in the meantime, thank you so much, Luca. So now moving on, it's my great pleasure to introduce Yassine. So Yassine is one of the 12 members of the Young Experts Tech for Health, which is a platform for young people to shape and guide the agenda towards achieving universal health coverage by 2030 through data and digital technologies. Yassine is a fellow alumni of a Master of Science in Global Health from the University of Geneva, so we know each other quite well. And she has a background in biochemistry and women's and gender studies. Alongside her academic training, Yassine has experience working as a sexual health activist, an environmental health technician for a local government, and recently as a consultant at Gavi, the Vaccine Alliance. As a member for the Young Experts Tech for Health group, Yassine and her peers advocate for, among many things, equity and youth inclusion, as well as impactful global and national governments for the use of digital technologies and AI in healthcare. So welcome, Yassine, and it's great to see you again.
It's great to see you all. Thank you so much for having me. Thank you to all of you for organizing this, and also for the Lancet Commission for putting this together. I think so far it has been amazing hearing from all the other speakers and just hearing all these different expertise and also ideas. And I think I will be really focusing today my part around governance, and I think Luca gracefully introduced the issue around governance very well, given that digital technology is not only it's a new digital technology in healthcare is such a new field, especially for governance, but also it is such a cross-cutting field. So you have for the first time now these technologies going from just being, just this technology being used by every day now to being, used in such a public content that's helped in many places. So then the question around governance become, okay, then who does what? Who is supposed to regulate this at a national level, at a global level? And I think that's really where a lot of work is starting to be done, and a lot of people are starting to get involved and seeing what we can do. And I think, as Luca beautifully mentioned, technology is one of those things that evolves every day so fast. Like some of the technology that we've been using 2-3 years ago now has been outdated, and then we are getting into new technologies. And I think that in itself poses a problem to a lot of governance, because if you can't keep up with things that are moving so fast, how do you create policies? How do you create the regulation that will allow you to not only protect your own interests, but also your population interests? So I think that's one of the huge issues around governance in digital technology. And so far we are seeing this new concept, this new awakening at the global level, I would say. I mean, you have the commission like TheLancet that are really looking at how can we help governance at a global level? How do we make sure that we are creating a set of rules and principles that allows us to really benefit from digital technology at the best way? So at the global level, you have, for instance, the Transform Health movement, which I'm sure Akash will talk a little bit more about later, that are coming together as coalition from different organizations that are working in this field, that are coming and looking at, okay, what are the best ways we can come together and leverage technology to not only ensure that we have good healthcare and that the technology is taking healthcare at a high level, but also ensuring that it is in a very equitable distribution of digital technology, and the participation of digital technology in healthcare is done properly. And I think also we have to be more conscious of the power of local governance, from national to regional governance. I think, as Dr. Shunara said earlier, like what organizations like the EU or the African Union are doing to look at their regional governance and how to better target these digital technologies and make sure that they are taking into account how their population interact, how their communities live, and especially do healthcare in general. And I think the issue around that for me is that usually how this digital technology are created from one part of the world. Usually these multinational companies are within, like, the borders of like the Western world, or at least they come in with this lens. And I think the issue is that now you have, in terms of regulation, you have certain government, for instance, like, the power that the EU as a regional governance can do versus, a country like Senegal can impose to other bigger companies is completely different. So I think when it comes to national governance with digital technologies, we need to really think of it as, okay, how do we support these developing countries? How do we provide them with not only the means to be able to protect their population, but also regulate what's happening within their borders with the technology coming abroad, but also making sure that these technologies, when they come inside the country, are really targeted to these people, and that the SOPs, the country actually makes sure that the SOPs and the regulation that they have put in place are being followed and are being adequately taken into account by these multinational companies who are very powerful and who are very I guess powerful in terms compared to this local governance. And I think the third really question is, when it comes to governance, then who is at the table, who are making this decision, whether it is at the global level or whether it is at a national level. And I believe that in terms of governance, it shouldn't be just about the local governance, just like in terms of politics doing all the work. I think because, again, technology is such a like fast field, everything is changing, and most of us don't understand. I think most of the people don't understand what's going on in technology. Most of the people in this space of decision making don't understand the technology. So that's, I think, where us young people come in, because again, we might not understand it, but we have an easier access to it. We might not automatically know everything in technology, but given our interaction with it in a daily basis, it's easier for us to understand. And I think that's where really we ought to be at the table, where we ought to be really part of this discussion, even at a higher governance level, not only just when it comes to advocacy. Yes, I think that's really important as young people, that we, as I think Dr. Shunara said, we start really pushing our governments more to not only include us into this conversation, because we have so much to bring, not only for regulation, but also we have so much to bring in terms of understanding technology. But also this is, I think, where there needs to be a lot of partnership between the public, with it being governance, but also the private sector, which is creating this technology, and making sure that these two are speaking the same language and these two are on the same page to understand each other and able to move forward. And lastly, I would just, I think, mention one thing that was throughout the discussion, we have been talking about young people. And I think for me, it's important to just say that as young people, we all always put in one group, but even within our group, we are not a homogeneous group. As young people, I think if you look at, people, just think about young people as very limited between 18 and 30, for instance. even within these groups, the way we are familiarized with technology is completely different. For instance, I wasn't born around technology, but then technology caught up with me in my teen years, versus, you know, those who are 18 now, who literally were born during this age, the technology transformation. I think even within our group, we see technology and we're interacting with it differently. I think that's very important to take into account when we're talking about young people, but also like how we are being talked about, but also what are we bringing in the table, because we are bringing two different but very important perspectives in terms of technology and how we see the world through technology. I think lastly also, I think we need to be very conscious of the fact that, yes, the young people, again, we all experience technology, but depending on our background, our place where we live, we see and experience this technology very differently. And I think that's very important to not just say, okay, young people are digital native, yes, but some of us have different socioeconomic interactions with technology. And I think that's the equity part where we need to really think more. And also when we are inviting young people, as we've all mentioned, this is really what this is about, inviting young people, whether it is at the governance level or whether it is at really the foundation of the creation of technology, making sure that we are including as this young people group as diverse as possible in terms of the way we interact with technology, the way we see it, but also our access to it every day. And that way we can make sure that whether it is policies, whether it is the technology itself, it's done in a very sustainable and equitable way. Thank you so much.
Thank you, Yassine. That was really insightful. You know, it's really interesting, you know, how oftentimes we lose track of the idea that, you know, when we talk about these digital interventions, you know, there's different contexts and there's different settings. And, you know, it's important when we talk about governance and how it affects people that, you know, we have this at the back of our minds. And it's also really good how you pointed out there's need for cross-cutting partnerships between the public, private sector, the governments, you know, without which, you know, the issue of the issue of governance, and of course, when we talk about different countries and how they apply digital technologies, we need to talk about the challenge of interoperability. We're not to pronounce that word, but it's a real issue, you know, because what works here in Switzerland may not be applicable in Nigeria, where I come from. And, you know, it's important that the people who are taking responsibility, whether it's from the international organizations front or the private sector, that this issue is really considered. And our last speaker, by the way, keep your questions coming. We are taking notes of them, and we want to quickly run through this session and then go into the debates. Our last speaker is Akash. He's a global health researcher and a biomedical engineer by profession. His work experience is at the interface of health policy, technology innovation, and social justice, with his time currently split between Transform Health as data policy manager and consultancy with the African region office of the WHO as an epidemiologist. He's involved in the setup of new network for global research and analysis for public health. For the Global Fund, he also focuses on creating and strengthening inclusive and equitable health governance structures for human rights-based management of health data and frontier technologies. Akash, the floor is yours.
Yeah, thank you, Arinze. Thanks, Mia, Katerina, Michaela, everybody involved in organizing this. You know, my pleasure being here. Thanks to also all the speakers before me. I think I learned a lot even listening to all of you, so thanks. I just want to start with saying half the world today lacks access to essential health services. That's nearly 4 billion people. A lot of these 4 billion people live in regions which are which have high populations of digital natives, whether they are Sub-Saharan Africa, Southeast Asia, Latin America. About 50% of Sub-Saharan Africa is less than 21. About 30% of Southern and Eastern Asia is less than 25. About 30% of Latin America is less than 25. A lot of digital natives, as we heard Luca and Yassine say before, live in these regions. There is also a critical shortage of health workforce in these regions and others. There is a lack of systemic trust, a lack of public trust in systems, in institutions. This is what we have today. And we also have ambitions to reach universal health coverage by 2030, the 3 billion goals. And it's becoming increasingly clear that it's going to be very hard for us to reach the UHC 2030 goals without digital transformation, without digital. Said before, digital innovation, involves not just AI, but also machine learning, neural networks, different parts of frontier technologies that we need to take. And a lot of these frontier technologies are driven by data. I think one of the comments just before me spoke about how data contributes directly to digital governance. And it's very true. There are lots of challenges around data. There are lots of important aspects that we need to concentrate on when it comes to data. And I'll get into that in a minute. But coming to what young people provide, if we want to reach the 2030 innovation goal, the 3 billion goals, if we want to reach universal health coverage, innovation is crucial. And in history, we've always seen innovation often comes from young populations. It's more crucial than ever now that we are in the middle of this digital revolution or data revolution or different names for these times. It's more crucial than ever that we involve young people in these conversations. We have young people leading these conversations where they are applicable. And we like Yassine said, there needs to be a spot on this table for young people, because innovation does not come without young people. There are different challenges, of course, to digital transformation, digital innovation. Some of them are technological. We've seen this with COVID. There are digital contact tracing tools, that some of them are not reliable, some of them are not accurate. Their potential is huge, but we do need to address those technological challenges. There are several ethical challenges. Some of the speakers before me spoke about this as well: the privacy of data, safety of data, security, ownership of data. Who owns the data we're contributing? Is it the governments? Is it us? How private is it? Where is it stored? How interoperable is it? Like Arinji just said before, there are several ethical challenges to data management that needs innovation again. Innovation that can be provided by young people. There are legal challenges. Yassine spoke about the governance aspects. We have no global benchmarks today around digital revolution, around digital technologies. We have no global standards, no global regulations. We are discussing some, but none exist right now. And when we want to develop these need to have space for equitable voices, for diverse, for inclusive, voices in governance. The point here is that there are so many different challenges, and data is crucial to all of these challenges. And data, some speakers often speak about 3 M's of data: misuse of data, missed use of data when a lot of data is missed, and missing data when we have data but we're not using them. Often this data actually has to do with young people, young populations. We don't disaggregate the data by age, often, by sex, often. These have direct implications on not just COVID, but also other health indicators, and misrepresents the young population. So not only do young populations have to be involved in the data collection, they've got to be involved in data management, in the digital revolution table, in the governance table, and so on. We need change. A lot of the systems we have today are reactive. A buzzword that's often used is siloed. A lot of the systems we have don't talk to each other. We need proactive systems. We need predictive systems. We need preventive systems. We need patient-centric systems. We need innovation for all these systems, and innovation provided by young people. The point is, it can't be a tokenistic approach. We can't say, okay, we have a table here on governance, on technologies, and then we have a few young people sitting around, not leading anything, just sitting around for the sake of it. It can't be a tokenistic thing. there is a lot of potential that we need to use, and they have to lead where, we have to lead where we have to. Yasin mentioned Transform Health. I just want to share one slide, but Mia and Arinze, I think I've been disabled from screen sharing. The Yasin and I are both friends, former alumnus of the same Master of Global Health program, but also now colleagues at this new initiative called the Transform Health Coalition, which is a bunch of different civil society organizations, governments, private sector organizations coming together to advocate for a larger voice for women, for young people. Thanks, Katharina. Thanks, Mia and Arinze. Yeah, and that's the setup that we have come up with, is moving from the language of digital health and digital revolution and so on, and saying health is crucial to this. So we must focus on health for all in the digital age. And when we advocate for the equitable application of digital technologies and data, and when we ensure no one is left behind, this includes young people. This includes young people from minute one. We can't, and Yasin mentioned, young people are not a specific section. We're a very intersectional group. We're a very representative group. And it's important to be as equitable as possible, both from geography's perspective, from the gender perspective, from the age perspective, and bring these equitable voices to the right places and to form the right solutions. One of the objectives of Transform Health, for instance, is to advocate for a global regulation. This could be an international health data regulations, that focus on digital technologies, on digital revolutions. What these regulations would bring to the global health table is to have a future that's well regulated, that doesn't exploit different underrepresented groups, different marginalized groups. This includes young people, and the potential of international health data regulations is huge, but it has to be multi-sectoral as well. We need to involve different voices. We need from different age groups, from different regions, from different sectors, and so on. If I could leave one takeaway, I would say innovation has conventionally, historically come many times from younger populations. We can say this is 18 to 30, 0 to 35, different organizations have different age groups, but it has come from younger populations. We are in the middle of this so-called data revolution, digital revolution, where innovation is crucial, both to reaching our health goals, both to reaching our development goals. Involving young people, leading with young people is crucial in this digital revolution and is crucial to innovation. And I'll stop there. Thanks.
Thanks so much, Akash. And yeah, ending on such a strong note, I think, is really key here. So just to enter a little bit with regards to the discussion and the questions, and I think we've had quite a few questions relating to the same thing with regards to the governance of how are we going to reimagine those systems, and more specifically, who should be involved in them. And we've been speaking about how, of course, we need to include youth, and of course we've been saying how it's such a diverse group, girls, boys, disabled, developing countries, high income countries. I mean, it's such a mixed bag. But also, I feel we've been talking a lot about how public-private partnerships are really key, and how we need to be interdisciplinary and intersectoral, and make sure that the private sector, notably tech companies, are at the table. And I mean, I'm just wondering, of course we need to include as many people as possible, but that could maybe create challenges, especially with regards to the private sector. And I know a few of our panelists work for the private sector, so it'd be quite interesting to hear your insights about that, especially with regards to accountability, and also with regards to data sharing and privacy of the people using it. So maybe we can start off with Shakira, and maybe we can go down the panel and see what your thoughts are with regards to that. So Shakira, I'll let you.
Sure, thanks, Mia. And you know, it was just amazing listening to everyone as well. I don't have a specific response to some of the things that you raised, and there's been quite a few questions in the chat box. But what I want to do this evening, and you know, as we go forward with these discussions where we say digital revolution, I'm just wondering, have we as young people ever broken down that term revolution? And I think we'll only achieve that, and I can see Arinze thinking, oh no, she's starting with her trouble now. But what I'm thinking about is how do we give meat to that word revolution? And revolution means that we fundamentally change things, which we're starting to do, but we're not there yet. Part of this revolution is also not that we need to be invited to tables and spaces, but that we should drive this revolution. And in driving that within this digital space, as I said earlier, I think we have direct access to policymakers, to decision makers, to ministers of health. And it's about how do we not get onto social media for our profile or ourselves, you know, that's obviously part of the package, but how do we get onto social media again to drive advocacy? And that's for me the key term this evening that I want to leave everyone with, is that revolution. How will we get there? Because I think it's unacceptable in South Africa that I have a better banking app than I do any app for healthcare. All the healthcare apps are fragmented. Only the private sector has an app, not the public sector. So I'm just going to give that quick food for thought, I guess.
Yeah, thanks for your comments. And are there any other panelists wishing to add things? Maybe raise your hand. No?
I would like to add a few
Great.
points. There were many questions on the chat, and I just quickly would like to go through a few of them. So first of all, I really liked what Akarsha, I'm sorry if I mispronounced your name, said about data. And I think that something really important, and we've seen this with the COVID pandemic, is that I believe that international, non-governmental, unbiased organizations need to play a more important role, and they have to have a stewardship and leadership role when it comes to data. Also because, so we saw that most of the countries, they've been reporting COVID deaths differently, which also leads us to not being able to compare countries. So I think these organizations, because they are non-biased, they're not biased to any governments, they should play a critical role in defining what data should be collected and how, so we can have terms for comparison between countries and between diseases, not just COVID. That's just an example that is very present in our minds. We were talking about well-being of young people, and in light of technology use, one of the most critical things that we have to think about young people and how they deal with technology is in regards to their mental health. How can we create programs that support mental health issues and problems, and make sure that people have access to the correct treatment and to the correct care for their problems? There's still a lot of prejudice when it comes to opening up about mental health issues, and that's something that definitely social media can help with, but at the same time, social media may cause those problems. So again, I think that we should talk more about these problems and make it okay for younger generations to talk about this as well, and to study these at universities, at conferences, at students associations, and make it normal to have these conversations. And then one last comment, I believe, was about technology and how technology can empower doctors and bring back joy to medicine. It's mainly because doctors, for each hour that they spend with the patients, they spend 2 hours working on medical records and entering data manually. So by leveraging these technologies and machine learning and bringing tech companies into these conversations at WHO, at UN, we can all build together systems that will make practice better and more efficient. We are still working in silos, and technology will evolve regardless. These companies, they have some of the best scientists, researchers in every single field. And if we don't find a way to have a dialogue between academia in order to provide the correct education or the most up-to-date education to future healthcare professionals, they may miss out on so many opportunities and chances to really understand how data analytics, machine learning, and all these new technologies can really improve the practice. And something that I always think about is I've never seen a professional, and we all know that academia takes slightly longer to adopt innovation. So some of the systems, they are more traditional, especially not in certain parts of the world. So I think young associations, as federations, and all these initiatives are really important to close the gap in the education needs of young healthcare professionals, students, but also all the practitioners who have the experience and the knowledge that might be needed to marry with these technologies. So one challenge for you guys is, why don't you organize a training for students or for young professionals on wearables? How to use them, how to understand the data that they provide, how to provide medical care, and to a patient that comes to your practice with an Apple Watch and says, well, now look at my data and tell me how I should be, how should my care look like? And so these types of workshops or trainings, they have to be more common. Right now, they don't really exist. It's not a topic that we often talk in medical conferences, and that needs to change. We need to have a multi-stakeholder approach, and we have to bring everybody to the table in order to really build an encompassing solution to this. Those are just a few remarks that I wanted to add to answer some of the questions on the chat. Thank you.
And Mia, if I may add a little bit, I think just regarding data, for me, I think we need to start looking at it in a more specific way. I think we're looking at data in terms of like, okay, how do we make, I think as Joanna said, how do we make sure that the data that is collected is very impartial, and that the data that is being put forth is very impartial, and then the role of the NGOs that they can play in there. But I think I will push it a bit further and see, how do we make sure that data, even the way it's collected, is really having in mind the population for whom it is being collected for. So in a sense, like, I think we need to look at data at a more community, or like very more clustered, like not clustered, but like at the community level. So who is collecting this data? Why are they collecting it? And how are they going to interpret this data? At the end of the day, if we have data that is collected in a remote village in sub-Saharan Africa, let's say, and then that data is analyzed in a different part of the world, you already are introducing a lot of biases. And then I think with technology, you have this loop where technology is used to collect data, and then data is being used now to fit in technology and seeing, okay, how do we better target this population? How do we better target the needs of this population? But if the data at the beginning is faulty, then you already have a huge issue in terms of the outcome of the data. So I think we need to really start thinking about data ownership from the collection level to even the analysis level to the practical level of it. And who needs to be part of the whole process at a community level to make sure that those whose data is being analyzed is being done fairly, it's being done in a way that's appropriate and helpful for the community. Again, over.
Thank you so much, Yassine. I think we can go on and on talking about the issue of data, but I just like to point out if there's, so I know there's a lot of questions, on the chat box, and some of them have already been directly answered by the panelists. And I also recognize there's a few persons in the participants group. I know some of you, I see Onyema from the WHO, I see Jessica from United Nations Pension Fund. I see a few people from the Masters of Global Health of the University of Geneva. If you have any pertinent questions, you can use the raise hand button, and you could perhaps turn on your video and ask your questions in person. But while you're on that, I would like to allow Michaela. I know you've put up a couple of questions on the group. I don't know if they've all been answered, but please feel free if you'd like to ask those questions directly.
Hey, thank you. I think there's been some good conversation started, and while I'm here, I just want to take the opportunity to thank all of you. This has been very exciting, and I've been like on my phone just telling my team how great this is going. I think that maybe a final question for me would be, well, what seems to be the simplest and the hardest question, which is just, how do we get started? We have all these great ideas, but what's our first next step in making sure that these ideas are heard and taken up? Because, yeah, it's great. So that's the last one for me, and thank you all so much for your incredible insights into this discussion.
Akash, would you like to take that one?
Yeah, thanks, Arinze. I think we need to, we often profess compassion, in being kind to different organizations who make mistakes, different countries who make mistakes. I think this is important more than ever now. We speak a lot about, what's missing from the governance tables, and this is important. We need to know what's missing. We need to know how we need to change. We need to know the mistakes we're making. But we also need to encourage what's going right. There are organizations out there who have started in the last couple of years and before, who have been trying to lay, the foundation for good global governance when it comes to health data, good for inclusive, equitable collaboration. Transform Health is one. There are even international organizations that have taken steps. Lancet FT Commission is one. We're eagerly looking forward to the recommendations, Michaela, by the way. So yeah, there are organizations out there who are doing the right things, and we need to encourage them to keep going with that. There are problems, but we'll find the solutions together.
Luca, would you happen to have any comments or thoughts on that topic?
Yeah, sure. Thanks, Arinze. And, I think I really agree in a lot of ways with what Akash has just said. We have this youth panel today, and we have really, amongst the five of us, quite a lot of different background and expertise. And I think this is exactly what was echoed in a lot of the presentations that we heard today, right? We were speaking about the importance of multi-stakeholder collaboration, bringing people around the table, working jointly to identify possible solutions. And I think, in an area which is as expansive, and really quite, complex as digital health and all the associated technologies, you really do need that more than ever. So I think, if you look at the challenges around digital health, if you look at, what maybe some of the needed policy changes, what are the resources needed that we can really ensure sustainable benefits from digital health solutions, it really spans across the, across everything, right? You need strategies and ecosystems at the national level, but also these need to be able to work together. You need to have the sufficient infrastructure and interoperability that we mentioned. And, you need some sort of an overarching governance on data even, right? As sort of a, let's say, an element that then supports the using of data to advance health. So all this is to say that really we need to look at this from a lot of different angles, and I don't think there's any other way to do that than to get really a broad amount of expertise together. And you know, I would say conversations like this one, where we're able to actively learn from one another, are really helpful, because I think before we can, you know, work to address the challenges, it's really important for us to understand where you know, where some of the specifics lie that we previously may not have considered, since it's something that is not directly related to what each of us are doing individually. So I think that's really something that, you know, resonated with me today through hearing the presentations, and also some of the points made right now by colleagues on the panel.
Thanks, Luca. So we've seen that a few people want to ask a question. So Rosemary, Harry, and Ramesh. So if you could please introduce yourself briefly and specify which panelist you'd like to answer your question. So we'll start with Rosemary. So I'll just unmute you if I manage, or unmute yourself. And so please introduce yourself and ask your question.
Okay, thanks a lot for the opportunity to say something, and I'm really happy about what we've been discussing, and like what Akash said, to say for us to be able to identify gaps, it means there is something actually that does exist, and then we identify what's missing. So I think what people are currently doing, and the push for young people to get into, you know, the digital divide, especially for health, global healthcare, is very good. So I work at the University of Oxford, but I originally come from Zimbabwe, and I work on a program where we are looking at the ethics of digital mental health for young people in Africa. So my immediate reaction when Joanna was speaking about the healthcare workers was, I think I wrote that down as someone in the questions, that whilst we are also talking about training and revolutionizing training of healthcare workers to embrace the digital innovation, what is also, if there are there things that are also happening on the ground in terms of empowering or getting the participants, your clients, the patients, to understand this shift. I say this from a perspective of a study that was done, and in this study they gave pregnant women some gadgets to use just to measure blood pressure during the week and in between their hospital visits. And these were rural women in Uganda. And some of the data that started to come in looked a bit strange. And then they sat down and had discussions with the women and said, what is happening with your blood pressure? Did we imagine that you have high blood pressure? Because you seem to be sending in figures that seem very strange. And when you come in, your blood pressure is actually high. And the comment from most of the women was that you gave me this new responsibility to be responsible for my own health, which I've never had in my life. Normally we you know, the white coat syndrome, the doctor knows it all, and my health is in the hands of my doctor. So now you give me a smartwatch or a gadget that I need to now take care of myself at home and send you guys information without taking people through, you know, things like what we've been discussing, like digital literacy. People don't really understand some of these things that we introduce to them. Worse still for us in mental health, that is even worse. You introduce a smartwatch that can measure mood swings and things like that to a person who already is struggling with their mental health, and now you are giving them the responsibility to transmit data, to make sure the gadget is charged, and it brings on some kind of anxiety, and people are not yet used to that in some countries. Now that I live in the UK, I'm quite used to having all my records at my fingertips, which was quite shocking to me, that I can just open my computer, put in a password, and I can see my whole health record from my GP. And I can change GP when I like and all those things. Those things never used to happen when I was in Zimbabwe. So this is a shift that is currently happening throughout the world, that we are placing some responsibility on patients, which is a good thing. But they need to.
Yeah, thank you. We're running out of time.
Yeah. Oh, yeah. Okay.
Do you have any final thoughts, maybe? Sorry, we're just running out a bit of time.
Yeah. So what is happening? I mean, is there any training for the communities?
Okay. Thank you. Which of the panelists like to answer that? Shakira, perhaps?
Shakira.
Or Akash? I think she mentioned you at the beginning of the...
Yeah, I'm not directly on the field when it comes to training, but I do know there are some good programs ongoing. I think Mia and Arinze and team also know about this. Through the Teredison network, they have well, a bit of background. Yes, this digital revolution shouldn't leave behind healthcare workers. Especially if you see in different parts of Sub-Saharan Africa, South Asia, the frontline health workers have been extremely influential, instrumental in getting changes with past health problems, with HIV, with TB. Community health workers are crucial to this. The digital revolution can't leave behind community health workers. So the question about training is that there are some examples out there that I know, and there are way more that I don't know, I'm sure. But one that frequently comes up in these discussions is that Teredison from Switzerland has this program in a few Western African countries, I think Burkina Faso, Mali, and others, where community health workers go door to door with tablets to record health data. While this may not be, something extremely sustainable, and while this may not be the best example of something, and I see just Rosemary's comment here, this is an example of community health workers being involved with health technology. I think Joanna can, address Rosemary's question about the patients better.
Yeah, thank you so much. Just very quickly to kind of wrap up these conversations. If we have on the call around 30 young healthcare professionals and there are not many programs that come to our mind, I think that's an answer on its own. And that clearly states that we need to do more work. We need to do more work with the communities and to make stronger healthcare programs to improve health literacy of the patients, especially those in rural areas or in underserved or underprivileged communities. Technologies, as I was mentioning, they will evolve anyways. Many of these companies, they will create programs such as Google has a program called Loon that brings Wi-Fi coverage to many rural areas in the world by sending balloons to space. So just to say that the technology will evolve, how are healthcare professionals respond to these advancements? So I believe that it's all about education, and by taking the burden out of doctors, instead of spending so much time taking care of admin tasks, if they can spend more time educating patients on how to use devices and wearables like these, because it has to be shown, it has to be made clear that these devices will improve their health. But it takes time, it takes connection. The doctor has to look the patient in the eye and explain that. Otherwise they might even think that they're doing the doctor's job, because they might not really understand that with that data that they are collecting for the doctors, it actually translates in improved health outcomes. So it's education from tech companies that can partner with healthcare professionals and organizations to develop the right product with the right fit for the needs that populations currently have, and then providing them training and education on how to use those tools and devices, because if healthcare professionals don't know how to use it, they certainly will not know how to educate their patients. And once we have these collaborations really well established and in place, then doctors and pharmacists, nurses, healthcare professionals, they can teach their patients on a one-on-one basis, because it takes time, it takes knowledge, it takes building that trust and confidence that those devices are there not to spy on them, not to collect their personal data, but really to improve their health outcomes. And with this, I just wanted to say a quick disclaimer. All the opinions that I shared during this session are my own. They are not affiliated with my employer or any of our organization that I may belong to. Sorry, I had to say this.
Okay, thank you, Joanna. So we're aiming to run over the next 5 to 10 minutes. We're going to take 2 more questions, one from Harry and one from Ramesh. So I would implore you to kindly just say your name, where you're joining us from, and ask your question directly. And then we'll answer that, and then we'll round up. So let's start with Harry.
Hi, so I'm Hari. I actually represent 2 organizations from India, which is the Global Health Youth Foundation and the South Indian Medical Students Association. So we kind of represent 17,000 medical students. We have a program, I would say a digital health advocacy program running for in terms of peer mentoring network for digital health and spreading awareness and advocating for digital health among medical students. We've been doing it through podcasts and education modules. So the coronavirus situation has really illuminated the need for digital health, especially in the field of telemedicine, and echoing the need for intersectionality and everything in terms of digital health. What we have been finding while advocating with medical students and with doctors, at least on the ground in India, is one, technology is, no matter how much we say it is reaching the masses, it's very difficult for the masses to access them. And the second thing, no matter how doctors are educated on the beneficial uses of technology or digital health or even telemedicine, for example, they are very uncomfortable with using digital health in terms of reaching the last mile. And also, let's say there's not a particular app, or there's not a particular document or an application which they use for digital health, and they're trying to reach the last mile through a simple video because let's say they don't have the knowledge about it. Let's say a last mile doctor sends a photograph of, or a healthcare worker sends a photograph of a particular illness to the doctor in an urban area. So what I find is the photography technique must be taught to the layperson, and the lighting and color is obviously different. But you see, in cameras, they say there's no 100% accuracy in terms of the light and coloring. So how exactly do doctors differentiate when there's no 100% accuracy? And it is, when they say it's 95 or 94%, again, the 6% does make a difference. So I guess if somebody could answer this, so I would say the social aspects, the technical aspects, if somebody could answer this, it would be very nice.
Thank you very much, Harry. Who would like to answer that? Any of the panelists?
Please just jump in.
Yeah. I think my understanding of the question.
Akash.
I'll volunteer, but I won't say much because I'm not a medical professional. But this is what Hari just said is like a perfect example why we need global standards, why we need global benchmarks, and also national, regional benchmarks. So people exactly know what to do. Healthcare professionals know how to reach the last mile. digital technology is new. These technologies are very new, so we don't have standards. We don't have benchmarks yet. But in 5 years, in 10 years, I hope we'll get there. But yeah, access to tech is something that's often missing, especially in countries like India, where the population is massive. And that's something that needs to be on our priorities.
Thank you, Akash. And we'll just take the last question. And we'll take the last question. Ramesh, if you're still on, please go ahead.
Colleagues, good evening or good afternoon, good morning, wherever you are. Ramesh Krishnamurthy, I'm a senior advisor at the World Health Organization headquarters in Geneva at the Data Analytics Department. I think I've listened to the conversations. I think they're very rich, very good. I think you all making a fantastic points. One advice I would like to give you, intergovernmental organizations like WHO, we have a lot of rules of engagement. So we can't simply make statements and do things that what appears to be taking a lot of time, and it will take a lot of time. You can't make it faster. So my suggestion to you, especially the Global Health Young Professional Initiative and Governing Health Futures, if they are entities or if there's a group of people, you all should collectively write a position paper for Lancet or position paper to circulate in the UN General Assembly next year, if not this year, because you're missing the timeline, to essentially identify 4 or 5 key things that government should remember, like employment and employing, and in terms of training, capacity building, blah, 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 opening up opportunities, and then investment in digital technologies, in some sort of financing, and then policy-enabled environments that needs to be there for future employment. So if there's no job description that says digital health expert in radiology, then you can't apply for the job. If there is no informatics expert called for as a job description, you can't apply for that job. So you may be very ambitious in transforming, but there needs to be governmental pathways for you to engage formally. So, but that can only happen by you voicing the opinion in a very structured way in the form of a position paper. And you can have more than one position paper, but all these conversations that have just occurred, it has to be put in a crystalline form, in a very distilled form, in 5 or 6 bullets that can be elaborated no more than 1 paragraph each. And that would be your position paper. And it should be usable by a minister by reading it and giving it to the youth ministry or some other ministry within the countries to take action. So that is kind of my comment. I think this discussion should continue to go on. And I think you have several thematic areas, that are in this topic that are quite complicated to discuss, and each one forms their own topical area. So consider this as a series and host these conversations on thematic areas, not all over the place, because digital health is an ocean. If you want to find a fish, you really need to know what fish you're looking for. Otherwise, you may catch whales and you may catch puffer fish, and they're all the different sizes. So I think that's kind of all I want to say. But congratulations to you, and thanks for letting me come on here at the end. Thank you.
Thank you so much. That was really insightful and very encouraging words from you. We definitely take your point, and within our team and our partners, we think that's definitely a call to action to do more than this. For us, this is a step in the right direction. These are stepping stones for what we believe would be the voice of young professionals. And as you've encouraged, we're definitely going to look into the possibility of developing concretely position statements. But really, we appreciate that comment.
Yeah. We also invite any of the participants to send us an email if you're interested, or any thoughts and comments, just to continue the conversation. Absolutely. It would be great. So yeah.
Absolutely. We welcome any not only comments, but also suggestions. It would be really useful to know what your thoughts or ideas would be for us as an initiative to further this agenda. On that note, I'd like to introduce Katerina.
Yes, not me.
Who would you like to introduce her?
I will introduce Katerina. So we will let Katerina do just the concluding remarks to this webinar. So she is the co-founder and co-president of the initiative. So Katerina, you may have the floor at long last.
Thank you. So thank you very much, Rinzi and Mia, for letting me wrap up this very interesting dialogue. As you might know, my name is Caterina Montagnoli. I'm the co-president and the co-founder of the Global Health Young Professional Initiative with a background in midwifery, and as well, I have the Master of Science in Global Health. So in recent time, we have experiencing a massive and rapid digitalization of health and healthcare. And on the one hand, we've been seeing the creation of new resources, and it is crazy to think that the pandemic actually enabled this process. And at the same time, we have seen how ready-to-use available resources were employed and redesigned at a full pace to respect clinical and social distancing needs. For example, application that control blood sugar, that allowed women suffering from gestational diabetes to be followed up virtually. And following, we have seen now a lot more resources mobilizing to different levels of prevention, not only for informing the public and educating it, but also to follow up and help the public taking control over their health. A clear example of that are the many health apps that count daily steps and give recommendation on the daily physical activity people should do. And so it's crazy to think about that we actually, we've been talking until now about the future, but actually the future is like just now. So we've been living, like as Shakira said, completely virtual life, but actually this virtual life should be fully exploited as the advocacy space for youth-led telehealth transition. We have talked about how the education is so essential. Joanna said, bring back joy to medicine, but I'm saying, what about the way around? What about patients learning about medicine? And it is what is happening actually. So, and again, for example, we talked about interdisciplinarity and the collaboration between unprecedented private sectors, for example, in pharmaceuticals, but also between disciplines, and how this is so true and so essential. And we are talking about interdisciplinarity, but we are also talk about collaboration between different generations, the generation of digital natives, here we are, and the generation of younger and even older at a higher governance level people. And we have talked about law that is an enabler of this transition to digitalization of health, and how youth should challenge it and help at the same time with their insights to create regulations on their hand. Innovation comes with you, but also comes with us. So my question now is, are we still able to recognize the difference between reality from social media or digitalization in general? But this is like one question that remains open. And also, is the massive digitalization a good thing or a bad thing? Like there are like so many pros and cons. The only thing that is sure is that this massive digitalization of health should not only be youth-driven, and we clearly understood during this dialogue how crucial is youth participation at all levels, and because youth are both a driver of this transition to digitalization, they also must be the gatekeepers of this transition. That means that they must not only be included, but they also must be actively asked and actively speak. They must raise their voice to be listened to. So just to conclude, I would like to thank all participants of this dialogue, especially the audience for the active participation. I would like to thank our speakers, starting from Shakira, Yasin, Luca, Akarsh, and then Joanna. our team of the Global Health Young Professional Initiative, Global Health Young Professional Initiative. So Mia and Arinzi, Lacey, Iman, Morgan, everyone also in the background. And finally want to thank the Lancet and Financial Times Commission Governing Health Future 2030 officer, Michaela Neumann, because it is thanks to her that we started this dialogue and we're kicking off on this topic. And it was great to see you all. And let's keep going on digital health. Let's keep dialoguing on digital health. Thank you for being here. And yeah. Bye, everyone.
Thank you, Katerina. Thank you, everybody.
Yeah, thank you.
Have a lovely evening. Sorry.
Well, thank you for organizing this.
Thank you very much.
Thank you, everybody.
Let's keep the conversation.
Yes.
Bye.
Bye.